What's Going on Seaville was made possible by the donations and services provided by Charlottesville Area Community Foundation, Community Endowment, Hollywood Theater Lab, Lighthouse Studio. What's Going on Seaville? I'm Lana Young. Tonight we're going to hear about the unsung heroes of the Charlottesville Mental Health and Wellness Coalition and how they're managing, with collaboration, to put the mental health system in Charlottesville right back on track. But before we do that, I'm going to transport you to the Blue Moon Diner on Main Street, where I got to rock out to the unique tunes of the Common School movement. Take a look.
March 15th, 2013, this is the Blue Moon Diner with the Common School movement. So many places that I felt so free. Your face alone that lets me go over what they see eventually and positively.
Erica Vixilio, welcome back to the show.
Thanks, Lana. It's great to be here.
And Karen Rifkin, welcome.
Thank you, thank you.
Now, you are both co-chairs of the Charlottesville Mental Health and Wellness Coalition, which we'll call the Coalition from here on out, just for ease of speaking. I'd love to start by talking about how it all got started. Who would like to start?
Well,
The floor is
ahead.
yours.
all right. So it was November of 2009, and basically what happened was I had walked 2 patients in 1 week through trying to access mental health services. They came to the free clinic in both cases and were beyond our scope of care. And it was in trying to find a place to refer them that I realized that there was nowhere for them to go. And it really concerned me that we were ping-ponging people to one another throughout the community. And my goal of the meeting was, let's own that. Let's be certain about what different agencies are providing and what they aren't providing, and make that information available so that we aren't sending people to somewhere where they're going to get sent somewhere else.
Okay, so you realized a gap in services. What was your first step? Who did you go to first? Because you're the executive director of the free clinic, so you already have a full-time job.
That's
so
right.
how did this get started?
Well, I think once Erica invited people to the free clinic, and we had various representatives from various agencies in town that not only provided mental health services, but also referred to those mental health services. I think our biggest step was just acknowledging the problem as it exists, and that it's a community problem. It isn't one agency's problem. It's not UMA's problem or the free clinic's problem or Region 10's problem. It's a problem that exists in our community, and we need to accept that and work as a community to solve it.
So the source of the problem, was it because any funding was pulled, or was there just a gap that just had never been filled?
I think that definitely had something to do with it. There were financial pressures that many agencies were feeling, and in some cases were having to scale back what they could do. So that is true to a degree, but also I don't think that we fully captured or knew what the need was. And so that was one of the very first things that we set up to accomplish was, let's really understand the different services provided by the agencies and create a referral sheet so that we know the eligibility, we know if there's a wait list. And I will say that by coming together and just creating that and creating more awareness among the agencies, we started to be able to do a better job with referrals and with realizing the lack of services available and that there were gaps, as you said before.
So that's really inspiring to me because, say, November 2009, the crisis was discovered, and then by December 2009, you had a room full of different agencies coming together. Was that easy to get what seemed to me to be competitive agencies together in the same room?
I think, it was easy as far as getting everyone together. I think everyone is concerned about the problem. Everyone was feeling the pressure in the community of people kind of bouncing around different agencies. And so that wasn't necessarily the problem. It was that initial foray into being open with each other and, taking away the guilt from everyone and not being able to solve the problem. Just saying, it's just us here, we're looking to solve the problem, it's not anyone else.
It was a safe place.
It was a
You
safe
created
place.
a safe place.
And what I liked the most was we were looking outside of our silos, and we were saying this is a community problem that needs a community solution, and we're going to be better at this united than alone. And what I'm the most proud of, I don't want to jump the gun, but what I'm the most proud of is that we have some very specific successes along the way, but it's the intangible things that have happened. And the fact is that we can tell you about a couple of specific programs that have been created through the coalition, but also each individual member agency is doing more. So
Wonderful.
it's like we're taking individual responsibilities within our own agencies, but we're also creating change together through collaboration. So
It's really a powerful thing.
it's
After this meeting of the minds, you created a list of priorities, and I think one of those was to have a public forum, which you accomplished at the Haven. Over 100 people showed up to that. Was that people in the community, professionals in the industry, or just everyday people being
I
a
think
part
it
of
was
that?
some of both, actually. It was not only stakeholder agencies that were interested in the mental health services in our area, but also people that had experience with mental health issues, people that had interest in mental health, and we were really looking for, their acknowledgement of the community problem and their solutions or ideas for us also. We had some goals in mind, but we wanted their input. Did they think we were on the right track, or what ideas did they have?
And that too is one of the things I'm the most excited about. We called it Seeds of Solutions.
Ooh.
That's what we were looking for.
I love that.
And 2 years later, when a donor invested in us with some funds and basically said, here's $50,000 because I believe in what you're doing, do something good with it. And what did we do? We went back to the Seeds of Solutions from that first community forum where someone had said it would be really great if there was just a voucher program. I've tried to get mental health services. I want to receive mental health services, but I can't afford them, and there aren't enough providers providing services for free or at low cost. So I wish there was a voucher program, so that we went back to that very initial idea and we said, well, let's look into that. Mm-hmm. And so we took some of the money and hired a consultant to research voucher programs, and what we came up with was something different, but it's meeting the same goal of providing increased services. So that forum really helped to inform our work, and we've had another one since then, and
Wonderful.
That's part of how we'll continue to operate is getting input from the community. Because while we have a lot of voices at the table, many agencies represented, we need to hear from the people that want to use the services.
Yes,
And
families of people that need the services,
Exactly.
the frustration they must feel by having all these gaps. I'm sure they feel really empowered by being part of those forums as well.
you could tell that people appreciated the opportunity to have a voice, and what I wanted to be sure that they would know is that there will be next steps, there will be follow-up, because you don't like to have those forums or those town halls and then no action. And I feel like that's really something that we've done well, is created actionable plans. And I think that that's why we're able to keep the momentum up with so many engaged agencies as well, is because we say we're going to do something and we do it. And so you come to a meeting and there's a focus, and and there's a lot of people committed to seeing things through.
I think it's wonderful. I think you're going to be inspiring to a lot of organizations that are sort of hitting their head against a wall. And I think generally it's because there is a sort of a competition between resources and services. But you've proven that you can actually come together and collaborate, and it actually works. I think the community generally feels sometimes that they're let down. And it sounds like they're not being let down in this case, which is really wonderful.
I hope not. Yeah.
Yeah.
And the collaboration, another thing I want to mention about it is that I feel like it's the buzzword in the nonprofit sector now, and with funders as well. Everyone is
good
looking for
buzzword, though.
collaboration. Well, and so, but Charlottesville Albemarle Community Foundation has launched its own pilot program to support collaboration. And so I'm really grateful to see the collaboration happening on the funding side as well. So they selected the Community Mental Health and Wellness Coalition as the pilot recipient of their new program for collaborative donation making.
Wonderful.
So we received a $100,000 grant from them, along with a commitment to help us identify funding for year 2 and year 3. So now the agencies are collaborating with the funders to find funding for year 2 and year 3 of our coalition services program, which is increasing access to services.
So this is
in the
breaking new
community.
ground, really.
It is.
It is.
On
And
both
it-
sides.
Was
Yeah,
it here first?
Here in Charlottesville. I love it. I love it when we are breaking new ground.
Groundbreakers. I know, it's
And I
really
think it's
phenomenal.
not just on the program side, it's also on the collaboration side. And I think, when people have come and talked with us, really talking about, leaving, the guilt at the table and everyone's perspective at the table, and trying to create a new collaborative culture and what that's like. We're learning about how to do that. And, each little agency, like Erica said, is giving their little piece. And along the way, we've had certain agencies give us a piece of a grant that they might have had that can help us along the way, or someone else has given, a piece of an anonymous donation that they might have had. And so all those little pieces have added together to keep us moving forward.
It's really heartwarming, actually. Out of your forum, you created a steering committee, is that right? And then 3 subcommittees. And I'm just going to read them. There was research, technology, evaluation. There was resource development, and lastly, service provision. And are those still intact, those committees?
Yeah,
they are.
They are. We actually kind of moved away for a little while, and then we've kind of moved right back to
Because
the
you found
same.
it worked the way
Yeah.
it was?
It did work. Yeah.
And so, without going into detail that would bore people that are watching, I will just say that evaluation. So, and noticing what's working and going back to it. So that was the original committee structure we came up with at the beginning. That was our best guess at what to do. We tried something else when we developed a charter, which helped to outline our responsibilities and commitments to one another. But we're going back to the original structure we had, feeling like it's going to support better engagement and keep us focused on what we're trying to do, which is create a better system of mental health care delivery in our community.
Wonderful. And do you have different people on those committees, or do you have the same kind of? It's kind of important to have different people
is.
representing each committee, isn't it?
Yeah.
So that you're not
it
getting
is.
bogged down by the other.
Well, that and frankly, everyone needs to step up and do a little bit of the work,
Yeah.
because it is a lot of work, and as you've already mentioned, it's in addition to full-time jobs that we all have, and so we want to be able to spread the work and also get more ideas and get more input and utilize the different talents that everyone brings to the table. So we ask that everyone that's involved with the coalition is on at least one committee.
Wonderful. That's fantastic. And I think a great way to maybe end the show is to go back to the programs you were talking about.
Right.
Do you want to tell us a little bit about those?
Sure.
So do you want to start with the healthy transitions?
Sure. One of the things, like we said, is kind of using a little bit of what had already been going on. And there already was a kind of re-entry committee working in the community that kind of grew into the coalition and worked with the coalition. And one of the needs was for people that were transitioning out of jail that had mental health issues and were on medication. A lot of times when they got discharged, they only had a certain amount of medicine, and it's very difficult to get in to see a psychiatrist, and certainly by the time their prescriptions ran out. And so one of the first programs was kind of an arrangement between probation and parole and Region 10, so that when people came out, they went right in for a psychiatric evaluation.
Wow.
And it's kind of this bridge program that ensures that they're continuing to get their medication as they're going back out into the community and finding jobs and insurance if they can, or getting back on their Medicaid to continue to pay for those services.
And such a simple name, Healthy Transition.
Isn't that great?
It sums it up.
And then the other big program is the one that we've alluded to. It's called the Coalition Services Program, and it was the one that came from the Seed of Solution for a
Right.
voucher program. And it's a program that's intended to provide services for people who are not being served elsewhere. So several of the member agencies have their own mental health services that they're providing. Region 10, ASG, Charlottesville Free Clinic, and this is created for people that don't fit the criteria at any of those places. So exactly the people that were getting ping-ponged about when we first had that meeting in 2009, now at least we can say, call Mental Health America and find out about this program, find out where you belong.
And the gap is stopped.
Well, we're trying to close
continuing
it.
to work
We're
on it.
closing it. I mean, no, you know what? The conversation is different. I did
Yeah, it
not
is.
feel hopeful even a year and a half ago. It felt like this big elephant in the room, and none of us knew how we were going to do better with mental health services in our community. And now I can hold my head up and say we're making progress. And you know, what more can you ask
That's
for?
really amazing. And I have to sort of end on your mission, which is collaborating for individual and community wellness. I don't think I've ever heard such a simple, clean mission statement.
Yes.
Right?
See?
It's true. I mean, usually they're lines and lines. I mean, yours just says it all, and it's a beautiful thing. I wish I could steer our viewers to a website, but we don't have one yet.
Not yet.
But for more information, is there a number to call or someone that...
You know, Mental Health America is really,
They have a website.
They have a
They have a
website,
website.
and they really are the clearinghouse for people looking for mental health services.
Perfect.
They're a great referral and a great place to start. So
Great. Mental Health America.
Yes.
Google Mental Health America if you need help. Well, ladies, thank you so much. And
you.
I congratulations on what you're doing, and I am so impressed. And keep doing what you're doing.
And you too, because
Thank
I
you.
think this is an awesome partnership that you have going here.
Thank you so much.
Appreciate
Really
you getting the word out.
And thank you for watching another episode of What's Going on Seville and supporting Kids Making Television. We are going to have the Common School movement take us out. See you next time.
My name's Darren Ball. I'm the Executive Director of Wintergreen Adaptive Sports. Our program is pretty large. We have about 400 lessons that we put on during the winter season and about 50 water sports lessons in the summer. In addition to that, we have 25 instructors in our water sports program and a little over 100 instructors in our snow sports program. Our number one objective for students in our program is that they realize some success. Success is defined differently for every single student. Some can ski independently down the mountain or be able to manipulate rapids in the river. Others experience a fun run, and they may just go down the hill or participate in a canoe or a tandem kayak for the experience of being outdoors and participating in recreation. Other participants in our program realize significant success. We also have a race program for our top-level skiers.
We give lessons to people with a full range of disabilities, whether those are intellectual disabilities or physical disabilities. And as such, we have a very large range of equipment. We have around $90,000 in adaptive equipment in this building.
At Wintergreen Adaptive Sports, we don't discriminate on any disability. We have participants in our program that are visually impaired, hearing impaired, as well as students with autism or developmental disabilities. We also have students with cerebral palsy, we have amputees, we help wounded warriors. So regardless of disability or age, you can qualify for our services.
By far the most rewarding part about this job is helping students find the highest level of independence that they can. And with some students, that is getting out there and skiing completely independently and becoming instructors themselves. With other students, that is simply coming out and being able to assist in their own turns going down the hill a little bit while instructors still give them some support. But helping them achieve that maximum level of independence is by far the most rewarding part of the job.
What do I think about the program overall? I think it's great. It enables children and adults with all types of disabilities to get out there and have fun and do what some of their family members do that they don't get to do on a regular basis. You know, hang out with friends. It's a pretty amazing program. I'm glad we came.